All right, so here we are. We're going to demonstrate some kinesio-taping for lymphedema, for edema of Eric's shoulder. He went through kind of a self-drainage technique that we recommend our patients do. Eric's still having some pain and some swelling in here, so we decided to kind of do a little adjunct therapy, help him assist the body to removal some of these fluids. That's what kinesio-taping does. It's got some excellent principles related to that. So we're actually using red or pink. There is some belief in color therapy where red would absorb blue or cold, and so we're using red or pink tape for that purpose. So here we go. So as Eric probably mentioned a little bit about the lymphatic pathways and things, we're going to try to drive the swelling towards some of his axillary lymph nodes. All right, so here we have our lymphatic taping to help Eric out with some swelling. It's a fan technique. We're trying to direct the swelling and flow into the axillary area and a little the infraclavicular area. Here I've kind of moved the tape around his incisions. He's got kind of a nice weave pattern. This tape is just non-therapeutic, no tension on here at all, just to help secure the ends to keep them from flipping off. But it's a nice little weave pattern. And this should really help with Eric with some swelling out of this deltoid and the upper arm area that he's been suffering from, in conjunction with the manual lymphatic drainage and some icing. Our next taping is going to be showing some supportive taping for the shoulder to help him with some sleeping at night, which he's having some difficulty with. And then we're going to progress with his range of motion and strengthening program, targeting some of his core musculature, his scapula, things like that. All right. All right, so here we are back with Eric again. I've showed a little taping technique, a little Kinesio-Tape taping technique for Eric. Feels like he's got a catch in his shoulder. His range of motion is doing really, really well. He's still in protective phase with the surgery. As you recall, he had a slap lesion, a superior labrum anterior posterior tear. And what we've done here is I've given him a bit of a mechanical correction for kinesio-taping, where we've positioned his humerus in a little better congruency. And I've done a little bit of mechanical block to that. The Kinesio-Tape kind of helps support that area. It's not real structurally sound, but it does do a nice job of kind of just blocking the anterior portion of his humeral joint a little bit, brought around the backside. And then this top tape is for a little bit of a humeral glide depression, just encouraging a little bit of an inferior glide of this humerus. You know, he's not really doing any active rotator cuff strengthening right now, obviously. And he's just feeling some pressure inside of his shoulder. It feels like things are just kind of pushing against structures. He complains about a catch. He might have described some different symptoms that he's occurring right now. So this is a nice little kinesio-tape technique, a little anterior block with a little humeral head depression. So hopefully that'll give you some relief, Eric, and then we'll check in on your next visit and we'll be able to expand his exercise program a little bit and we'll show you what we're doing with that.
All right, so today is post-op day 11, the day after Chris used the Kinesio-Tape to help me with my swelling as well as some pain that I was having in the shoulder. He used a fan technique to reduce the edema, which is the swelling that I was having down in the fingers and in the armpit area and out in the lateral deltoid area of my shoulder. And he also used a positional correction technique to help move the head of the humerus, which is the ball and socket joint, to help move it a little bit back and down, because I was having this feeling like the shoulder was riding a little forward in the socket and I was getting this very sharp catching kind of a pain in the front of the shoulder. And he used this taping technique to sort of help correct that. And I can say this morning that, number one, my swelling is remarkably better. I can actually make a fist now. My fingers look like they're about the same size as the other hand. I don't have nearly the swelling in the fingers, nor do I have the same amount of swelling in this armpit area. So that definitely worked wonders on the swelling. And also, as far as the positional correction that he did, I was able to get some sleep last night without that annoying anterior shoulder pain where I had that sharp catching feeling. The shoulder felt more stable and secure in the tape. I think the tape not only helps with actually creating a little bit of correction biomechanically, but also what's called the proprioception, which is just the sensation of the tape cuffing the shoulder, gave me a sense of security and stability there that allowed me to get some sleep and helped reduce that pain. So I think both taping techniques were very successful. and I think I may try that again today. The tape really only lasted overnight. Sometimes it'll last longer, but I took 2 showers and everything loosened up, so I removed it. I'll probably have him tape me again in the same manner for both swelling and positional correction, and hopefully that will help me get a little better night's sleep. So all in all, very successful use of the Kinesio-Tape.